before 2012, when the death rate from CVDs fell by 37% in the 5 largest Western European countries. It was France and Germany, UK, Spain, and Italy. And this progress was a result of the combination of medical innovation and was supported by a mix of healthcare policies and guidelines that significantly improved patients' lives. Regrettably, the situation we are witnessing today is quite the opposite. The progress has stalled and even reversed in some member states. In certain regions, heart disease deaths are rising again due to the factors like unhealthy lifestyles or aging population. And this is a warning sign that we cannot ignore. Unless we do something now, the number of Europeans suffering and dying from CVDs will increase dramatically, and we should not let that happen. But beyond the human tragedy, we need to acknowledge also the impact that CVDs has on our economies. Cardiovascular disorders cost the EU, as we heard, around 282 billion each year, with healthcare costs alone representing 52% of this figure. So the productivity losses and informal care contribute to the remaining costs, highlighting the widespread impact that CVD has not only on individuals and their families, but also on national economies and healthcare systems. To put it plainly, when Europeans are sick, Europe becomes weaker economically. Our union's productivity and resilience and even competitiveness are undermined by the weight of 62 million Europeans living with cardiovascular conditions and the millions more caregivers and family members affected alongside them. This is why investing in cardiovascular health is not just a medical, but it is also economic necessity. So how do we go from this lose-lose to win-win situation? How do we both make Europeans healthier and our economies stronger? The answer is by adopting a comprehensive cardiovascular health plan as soon as possible. Learning from the success of the Europe's Beating Cancer Plan, we must put the same effort and resources, of course, to improve prevention, treatment, and quality of life of CVD patients. Addressing these crisis, I would say, is urgent. CVDs has been with us for a long time, yet it hasn't received the coordinated action it deserves. And we cannot no longer accept this inaction. Because every day we delay, 5,000 Europeans die from CVDs on average. Every day, more families are shattered by a preventable stroke or heart attack. This is our call to action. We must unite and act now to change the course of cardiovascular health in Europe. Colleagues, when we begin with discussions on cardiovascular health plan, I urge you to take into consideration that the fact that there is a particularly urgency in how cardiovascular disease affects women. Many still mistakenly view heart disease as a men's problem. This is a dangerous misconception, and it is costing women's lives. CVD is the leading cause of death for women in almost every single EU country. It accounts for about 37% of all female deaths and killing twice as many women each year as all forms of cancer combined. We should be aware of this. This is think about that a woman in Europe is far more likely to die from a heart attack or stroke than from breast cancer, for example. Women's health, women's heart health has been, I would say, understudied, underdiagnosed, undertreated for too long. So women often don't fit the typical heart attack profile we see in the textbooks. So we should keep this in mind when discussing and talking and planning actions regarding new cardiovascular health plan. So I would say that concrete actions are needed. We need research that specifically looks at how heart disease manifests in women. We need awareness campaigns that speak to women so they become aware that the heart attack doesn't always look like it does in men. The fact that you are all here today from different institutions, I see also my fellow colleagues from different political groups, from different committees and countries. That gives me hope. Indeed, it gives me hope. It shows that the fight against heart disease truly unites us across political and national lines, because obviously heart disease does not check our party membership before it strikes, and our response must be equally non-partisan. I want to thank each of you for joining this group. Many of you have personal motivations. Perhaps you are former health professionals, or you have family members with heart conditions, or you simply see the urge, the urgency as I do. And whatever is your reason, your commitment is the strength of our coalition, I would say. Our group includes colleagues coming from, as I said, the different member states, different committees and different political parties. And currently, we have much more than 16 colleagues, because while we were preparing this launch event, many other colleagues expressed their interest to join us. And I'm glad because since they are coming from different committees, obviously they will bring their special point of view and expertise in this group, which means that our message will be carried out into many corners of the Parliament's work. I would like also to extend my thanks to the European Alliance for Cardiovascular Health, which serves as the secretariat to our group. Through them, we stay connected to patients, to doctors, to researchers, and civil society who are working on the ground to reduce CVDs. I'm sure that this MEP interest group will serve as a kind of forum, not just for us policymakers to talk with each other, but to listen to experts and citizens and to champion their best ideas here in the Parliament. So what do we aim to achieve? Let me outline the key priorities for 2025 that this group will pursue. This is our, let's say, roadmap for the year ahead, and I invite you all to contribute to it. Today we begin with the landmark moment. We launch the MEP Cardiovascular Health Group. And this launch will not only introduce our colleagues in the European Parliament to each and its wide network of dedicated stakeholders, but also mark the unveiling of the revamped roadmap to the European Cardiovascular Health Plan. And this plan will be our compass in setting clear priorities and expectations for the action at the EU level. And in the second quarter, we will also there will be informal policy exchanges. These sessions are opportunities, of course, to foster the trust, exchange ideas, and explore what each partners and policymakers believes are the most pressing needs to enhance cardiovascular health. In the third quarter, we turn to communication and public engagement. We will support a strategic campaign around World Health Day and World Strike Day, aimed at raising awareness and building momentum for policy change. And this campaign will include coordinated messages from MEPs alongside impactful video and social media content to highlight enormous burden of cardiovascular disease and the urgent need of political action. And finally, in the last fourth quarter, we end the year with the Cardiovascular Health Summit. That will be our main event. This high-level gathering will bring together EU institutions and health stakeholders, patient representatives, and healthcare professionals. We will take stock of the progress we made. We will assess the implementation of each roadmap recommendation and explore the next steps towards a dedicated EU cardiovascular health plan. So finally, we are at the beginning. Yes, it is true. A long journey lies ahead of us, and each step we take along the way must reflect our main goal, and that is making cardiovascular health a policy priority within the European Union. Today, we have only lit a flame. It now needs to be kept going, and this will only be achieved if we work proactively in this group, and if we share the same sense of collaboration. So in that spirit, I now give the floor to you, Miriam, again. Thank you so much. Thank you for being here.
Thank you so much, MEP Jerkovic. Just a few follow-up questions then. I mean, you sort of set out the ambitions for this group, but one of the things that really sort of struck a chord with me in what you've said so far in your opening statement was where you talked about the gender imbalance. Is that something that you know, as the chair, as someone who's part of this 16+ member group, is that something that you're really going to try to push in terms of policy and awareness, especially amongst, you know, everyday Europeans?
Yeah, of course, that's extremely important. And I hope, thank you, Lorena, for being here. I count on you, you know, really very hard. I'm sure that you understand this gender gap that we really need to handle. There are so many proofs, so many data which go along with this, my previous statement. So having a plan without considering these well-known facts would be a mistake. So I'm really enthusiastic, and I see, talking with my colleagues, we also have many interest group, but one is especially dealing with the women's health. So there is a broad understanding of this issue, of this problem. So I'm sure that we will fight very strong when the plan comes to this house.
And then just one other question. I mean, this is of course a launch event. The group itself. I can see some of the MEPs there. Hello, MEP Andrikaitis, we will be coming to you shortly. It's quite a small group though, isn't it? Is there a reason behind it initially starting off as quite a small group?
Yeah, it won't be, you saw on the slide 16, but this number is already much higher because we prepared slides and I didn't have time to intervene. But the interest for this group is really high. So with the time and our activities, you will see that the number of our colleagues will be much higher.
Thank you so much. Okay, so I'm going to allow some of the MEPs to talk to us. I know you very well, sir. MEP Andrew Katais, if you'd like to share some of the reasons why you wanted to be a part of this group. I mean, I think we all know, how much you've worked in health already, but yeah, let's share some reflections.
First of all, may I react? It is not small group. It's very strong one.
Strong.
One of the strongest group in this house. Because we're all together, not only members of European Parliament, but look, full room of our activists. Of course, congratulations. Romana, you did excellent speech. You presented excellent plan. Let's act, let's work together, and let's do what we can achieve. Because we know when we are looking into prevention issues, we can find a lot of alliance around us. Starting with tobacco coalition, finishing with alcohol, starting with nutritional labeling coalition with consumers, and so on, so on. We have good opportunity now as never before to raise health issues high on the agenda, and of course, go together, building much more synergetic view, looking into European Health Union development. Second building block of European Health Union should include big part as cardiovascular diseases. As one of main chapters of second building, we need what? We need sustainable financial support. And in front of new multi-annual financial framework, now it's up to us to fight and to say, look, 5.3 billion, it's not enough. It's shame on European Union if we have only 5.3 billion for EU for health activities, including cancer, 4 billion, and that's all. We need to say we need much more. For example, that's 25 billion euros we need to have concretely dedicated to development of second building block of the European Health Union. And cardiovascular disease strategy should be included as more holistic. I welcome very much, excellent proposal, a joint reaction to the Council conclusions on cardiovascular health. A lot of organizations sign such, recommendations. We need to do more, and we need to follow those recommendations. It would be excellent exercise. Thank you so much.
Who's brave enough to follow him? Both?
I was going to say I haven't had as much coffee, but clearly my heart isn't as pumping as my colleague here. But let me just say, first and foremost, thank you, Romana, and thank you to everybody. I think it's been a long time since I stepped into a room specifically on health that had standing room only, and that's a credit to everyone, including yourself and your team. I'm an Irish MEP sitting within the EPP. It'd be remiss of me not to acknowledge the man sitting beside me, David, who will speak in just a bit, but also Neil Johnson, who led the charge in the west of Ireland, across Ireland really, but west of Ireland, in an organisation called CRE for over 3 decades, and has been doing Trojan work at making sure we as MEPs are educated on the impact of what cardiovascular health. And I have to say, in the last mandate, cardiovascular issues impacted my family in terms of my father. It was only meeting the man there at the end where I began to understand, as women, the 229 million citizens that elected us across the EU have been left out in many of the research, innovation, and conversation. And I blame him for opening my eyes, in the sense of always forgetting who's not at the table, whose voice is not being heard. So I'm really, really delighted on behalf of many of our Irish colleagues to be here and to acknowledge you all in the room. And I really, really look forward, as was shared, to making it a reality for the 450 million citizens that we represent and who elected us to do here, to this place, this great parliament, now more than ever, and have health be the pinpoint of our conversation. So thank you very much.
Well, I think as MEP Walsh brought up Neil, if I could ask you to speak on behalf of all of us and just introduce yourself to everyone in the room.
Yeah, so thank you very much, Maria, for that. Those very kind remarks. And I think this is a very important occasion, as already been stated. I congratulate the MEPs for coming together on this. As has been mentioned, it's a small group, but from small drops in the ocean, the waves are created. And so hopefully this is the start of a wave, which is long overdue. And I particularly want to echo what Maria has just alluded to, and indeed the opening speaker, the issue with regard to the gender gap between men and women in cardiovascular health is something that really needs to be addressed. We know that women are understudied, underdetected, underdiagnosed, and undertreated. So even if we were to mobilize that percentage of the population alone, I know as a man, the force of women can be very significant. But I also think that it's something that men need to also address, because it's not just a women's issue. Women play an enormous role in families and societies. And I think this is an issue that absolutely needs to be prioritized in the cardiovascular health plan. So thank you, Maria, for championing it. Thank you, MEP Jerkovic. Thank you.
Okay, so we've spoken about the gender imbalance, but there's also a lady here I was speaking to, Magdalena, who I think should take the floor, because she has a really interesting point when it comes to children as well.
You've taken me by surprise here. Thank you. Good morning, everyone. And I would like to first say hvala, thank you, ačiū, muchas gracias, eucharisto, for all the MEPs who are here and express their interest in supporting cardiovascular health. I think we have an amazing opportunity to shift away from the disease without forgetting those who are affected today towards healthy future. How long will it take us to get to this future? 5, 10 years? As you said, it's a long journey. And I would like us to think, when we think about adults and grown-up men and women, about the future we create for the young Europeans and the children of Europe. I take this opportunity to represent the voice of patients, those who we've missed already. We failed them because they became cardiovascular disease patients. But I also represent today the voice of people who can enjoy healthy future, healthy cardiovascular future. And therefore, I'm excited to be here today. Please, lights back on. To ask for early prevention, screening and detection, so we can really make a mark for those young Europeans who cannot be represented today in the room, but are represented by us as the advocacy groups. Once again, thank you, and I look forward to collaborating as FH Europe Foundation, but also as partner of each with all of you across Europe and beyond, because we are setting the tone and energy beyond Europe. Thank you.
Is there anyone perhaps from this side of the room that would like to say something just quickly? Anyone like to put up? Yeah, please go ahead. Yeah, just use the button.
Thank you. A warm welcome from the European Heart Network, bringing together heart foundations and patient organizations across Europe. So we are very much thrilled that you come with a plan to support us in this house. It's very important, the voice of the parliamentarians. We need it, as well as the Commission, who puts the pen to the paper. And then we need, of course, what has always been already strongly the member states. They have been pushing us to be here together because they said at national level, we need a cardiovascular health plan. It's urgent. After COVID, we are suffering, our patients are suffering, and the numbers are getting up. So it is very important that we take up this journey, this roadmap with our compass we have and a strong political support. So I'm very happy to see that. And from EHN side, we always are strong on the patient's voice. We want the prevention. We want to speak to policies which get people, let people stay healthy before they get ill. But if they are ill, that they are taken care of. We have a healthy environment, healthy choices, food, tobacco, but also air pollution and physical activities, very important elements for everyday life, for everyday health. And last but not least, it was said, research. We need to catch up on innovation and research because that has been lacking behind for many, many years in cardiovascular health. And it is this innovation we need to see in order to make the picture round, to let it happen. So we're looking very much forward to work with everybody together to get cardiovascular health on the plan and also implemented. So that is the magic word I think we are striving all for. Thank you very much for this great event.
I just have a quick sort of follow-up. I think when we talk about ways in which we can, prevent any sort of CVD, you mentioned fitness. What would be the bare minimum? Because for lots of people who perhaps, have had some sort of, health issue, they don't quite know where to start when it comes to getting fit or healthy again, or trying to improve their sort of health and fitness. So what is a good starting point?
I think it's always good to know exactly where you stand. So having a consultation with a physician is always good to know where you are. But there's also a lot of, let's say, communities, charities, foundations there who stand ready to support patients among each other to say what needs to be done. And I think a good start is to be connected, to not be alone. We saw it in COVID to what it leads. It's good to connect with people, with organizations, and get support and advice on the specific situation you have. And let's say also in the community, friends, families, have a healthy approach overall, try to look for this healthy environment, to create a healthy environment. And I think there are clear guidelines on how to be physically active. I think it's half an hour every day. That's already great. So I think it needs to be integrated in the everyday life. It needs to happen. And that's the easiest if it's integrated in the everyday life. And I think if a community strives together through the transport system, through healthy cities, I think there's also a political level, many layers where you can see it's important to have synergies. So we need a political level, we need a community level, we need the doctors level, we need the patients coming together. There's much to do. And to start with half an hour every day, I think is good.
Thank you. Well, you also mentioned the roadmap. So I think everyone can see, if you've got it in front of you on the tables, here's a roadmap. I think everyone sitting over there, you should have a copy as well. So let me hand over to each to understand their role. Oh, the lights are back on. That's nice. So please welcome Professor Susanna Price from the EACH Secretariat. She has... you're sort of, coming at the last moment, so we really appreciate you joining us, and please take the floor.
Thank you very much. And MEP Djokovic, thank you so much for your fantastic presentation and the extraordinary dedication and enthusiasm I'm hearing actually from all around the room. Could you please put up the first slide, because I think it's a really important one. I'm just going to take you a little bit through, for those who don't know EACH through and through, a little tiny bit of history. So EACH was formed in 2021. And I'm both a cardiologist and intensivist, and 2021 was the tail end of the pandemic. And I remember the discussions that were happening, and it was an extraordinary time because on the one hand, we had intensive care units full of really sick patients still. And on the other hand, it shows you what a huge priority cardiovascular health really was. That at that time, healthcare professionals and scientific societies were coming together to say, we have to do something about this, even at a time when we were being pulled in so many different directions. So EACH is now an alliance of 21 different societies, very different. So some representing patients, some representing industry, some representing scientific societies, and it's 21 and growing. What does EACH do? Well, it provides a platform where we can come together, we can discuss, we can learn from each other's expertise. But what has emerged from that, and emerged really very quickly, was a real need for a sharp focus on cardiovascular health across Europe. And this has come late, but at last we have really serious international and European societies coming together to advocate very strongly that we should speak with one voice in this area. This platform now allows us to speak to those who are in charge of driving policy and turning this into something that really is concrete and will change the lives of Europeans, absolutely, for sure. Could I have the next slide, please? So that was 2021. Roll forward 2022, we're now really at the tail end of the pandemic, and already this alliance is now formally calling for the development of a cardiovascular health plan for Europe. So only a year later. And this came because people in this room decided to find what was common ground and what we could work on together to make a difference for the patients and the people that we serve as researchers, as clinicians, as healthcare professionals, industry, and also listening to our patients and giving them the voice that they really, really deserve. From this 21 very different entities came with one voice and then have become really quite noisy. And I think that's why we're sitting here today, because we have found a voice through the politicians and the people that really will drive change. The events that happened from 2022 really until now have been extraordinary, very broad, some in Brussels, some in Strasbourg, and many of the people in this room were present at many of these events. So talking about awareness, some kind of campaigning, some certain events, and one, I think, the Strasbourg event led by each was extraordinary, where we had more than 100 MEPs sitting down and pledging that they would commit to driving forward a cardiovascular health plan for our citizens. Next slide, please. I feel really very humbled here because I hadn't really appreciated, I'm just a doctor, I hadn't appreciated how vital the role of politicians is in driving things forward. So we can have all the knowledge in the world, but if we can't translate that into meaningful policies, it doesn't really help anybody. So we in each, and I in particular, am so grateful for the support that we've had from Ursula von der Leyen, from the Minister for Health, from yourselves as MEPs, but also political parties. As we heard, cardiovascular disease crosses all political boundaries. So we're extraordinarily grateful for the dedication that you're providing in supporting the development and implementation of cardiovascular health plan. And it's very easy, I think, sometimes to think of cardiovascular health in very sort of usual ways. But when I look at a patient in front of me in my intensive care unit who we're trying to save their life, and they're sick and they're young and they're trying to die, and we're doing everything we can to give them their life back, you realize that actually cardiovascular health touches everything. So everything we do to that patient will be affected by the research that's gone into what we can do, digital technology for the monitoring of that patient. And the fact that they're in front of me is impacted by gender, is impacted by the quality of the environment and the air that they breathe, is impacted by whether they have or have not had any kind of cardiovascular health check that led them to be lying in the bed in front of me. So everything that you do that may not seem immediately health related absolutely impacts what we do every day at the bedside for our patients. So we're immensely, immensely grateful. So that sort of broad thing really leads me then to each European cardiovascular health plan, a kind of roadmap to how can we really work together, and this is the beginning of a journey, how can we work together to turn what we know into meaningful policies that will make a difference to citizens, their lives every day going forward. And that really is what this roadmap is, the beginning of this dialogue. Could I have the next slide, please? Within it, you'll see, and I'm going to talk very, very briefly, there are 5 proposed pillars that we could potentially discuss and craft to turn into something that's very meaningful. And in no particular order, I'll start with data and looking at a European Cardiovascular Health Knowledge Centre. This is a call to action for this. So, of course, with appropriate governance infrastructure, of course, a call to look at existing registries, the data that we already have, looking at patients' electronic health records. How can we bring together the data related to cardiovascular health and cardiovascular disease for citizens and for patients and bring them into one large plan that we could work for together? The second call really relates to a European Cardiovascular Health Observatory. So learning where policy has been extraordinarily effective, how do we then take that modify it, craft it, and roll it out to other member states so we can really leverage the expertise that we've got, learn from what we've got, and then implement it elsewhere. The third, of course, talks about prevention. There's so much that we could do for prevention. We can't push it all to the citizens. We have a duty and a responsibility to make it easier for people to eat healthily, to not smoke, to exercise. It's not everybody's necessarily their choice that they have high cardiovascular risk. So we would absolutely make a call for an EU cardiovascular health check and to work with national member states so they can roll these out in their own countries. Next, let's talk about research. We heard about research. If I look at the history of cardiovascular innovation and research, it comes from the heart of Europe. Everything we do in cardiovascular disease, be it putting stents in patients, be it pacemakers, be it putting valves in without having to stop the heart and go on bypass, all of these things came from innovations that came through Europe. So we need to make sure that Europe stays at the top of research and innovation in cardiovascular health and cardiovascular disease, because it's what we do best. And then finally, talking about the digital revolution, which is already here. For me, cardiovascular medicine is absolutely synonymous with artificial intelligence. Everything you see, every AED, every defibrillator you see has got AI technology within it. Every pacemaker that you see has got AI technology. The wearable technology that our patients and our citizens use, cardiovascular health has for decades been there, and it should be right up front and center. It should be forefront of where we are in this digital revolution. So great to have digitally literate citizens, great to have digitally literate healthcare professionals, but absolutely Europe should be leading in the digital revolution for cardiovascular health. Next slide, please. And really now this then moves on to looking at individual member states, because it's great to have huge ambition, but what does that translate into for individual member countries? And we need to work with our individual countries, with also, I would say, for cardiovascular, our national cardiac societies, to say, how can we really change things up on a national level? So we're talking about serious prevention here. We're talking about early access to optimal treatment with best evidence base. We're talking about rehabilitation, giving people their lives back so they can live their lives well, and not ignoring, absolutely not ignoring, this significant impact on the mental health of people who've suffered something that is potentially life-limiting, life-threatening, and for some people, unfortunately, life-ending. For the patients and for their relatives, we cannot ignore the effects on their mental health. And of course, we have to talk about equity of access. How do we tackle the inequalities of access to life-saving technologies across the whole of Europe? So with that, I'd say thank you so much for your attention. And I'm really looking forward to this beginning of this extraordinary dialogue, because I genuinely believe we can change things up for our citizens. Thank you.
Thank you so much, Susanna. Well, I think we should now hand over to the representative from the European Commission, Lorena. You've heard from a lot of different speakers, MEPs. You've also heard from Susanna talking about the plan, the 5 pillars as well. And then also you've had MEPs talking about, the budget for health is not enough. So lots of different things for you to perhaps to comment on. Please go ahead.
Thank you very much, Mariam. I mean, don't expect from me a big speech. I think I'm here mainly to listen to what is said around, and also because we are working on it. But I think that a lot has been already said. I'm not going to mention any more figures because we have them all. Number 1 cause of death in the European Union, and indeed affecting citizens, and I think I agree with all of those that have said that I don't think there's a single family in the European Union that has not been affected by this, and of course this includes mine. It has been said a lot as well that this is a disease where inequalities are being seen. Gender has been mentioned, others, but I would say also geographical. When you see Central and Eastern countries, how they are affected with respect to Western ones in the European Union. And I think it has also been mentioned, the impact also on our economy. Figures that are huge. I had the one of 250 billion, now it's grown to 282, and apparently it's even becoming bigger, which is not surprising when you see the aging population. So when you see the situation that we are going to face in the coming years, whether it's economic, geopolitical, and we really afford to have this burden in the European Union. And I think this is in these terms that we need to look at this. And I'm therefore really, really happy that you have created this group. Romana and I have been working already in the past together, so I know her strength. We worked in particular in the EID wallet regulation. So I'm sure you are in good hands here. This is really a good moment to create this group. As has been mentioned also by Susanna, we have a mandate in the mission letter to our commissioner. It is mentioned that we need to work on prevention, and we need to work on a common approach, among other things, on cardiovascular. And that it has to be drawing on the European Beating Cancer Plan. What does it mean? It means that it has to be comprehensive. So very much in line to what has been said, from prevention to early detection, screening, treatment, but also quality of life and rehabilitation. We will need to look at all of these. But it's something that is interesting as well is that, of course, cardiovascular is very different from cancer for many reasons. So we will need to tackle it in its specificities. At the same time, it is one of them is that, as mentioned, to a great extent, lifestyle is very much involved, and the importance of health checks and screening. This means that we can create a big impact, so that we can really act and see the results. And that's something that we need to take in mind, that this cannot be just a plan. We need to see the outcome. I don't know yet what will be in the plan, but we are certainly listening to everybody. Early detection and screening has been mentioned. We have a strong call from member states in the council conclusions that were adopted in December, and you have just mentioned it as well. So this is certainly something which we will need to work. And there is something I'm going to mention, because the commissioner has said it many times, that the importance of digital, and I fully agree with what Susanna said. And here is where probably I will feel more comfortable because of my past of 16 years working in this field in the Commission. I would say that, of course, we have to bring digital, but I would say even more. This is, cardiovascular is an ideal and natural entry point to apply AI. Why? First, because there's a very strong clinical need, but also, as mentioned by Susanna, because the data is there. The data is there. We have the e-health records, we have imaging, we have biomarkers. Of course, we need to have it structured and accessible, and we need a framework to use it. So we have a strong clinical need, we have the data, and we have very established expert networks, including each, of course. So this makes this an ideal entry point to show how really applying AI and digital tools can really revolutionize how we deal with a concrete disease. And this is very much in line with the AI Continent Action Plan and with the upcoming Apply AI strategy. And of course, we have the e-health data space now that gives us the framework for this managing of the data. So let's say all the ingredients are there. I take note of the strong call for action in this room for research in the field, and certainly we will be talking with the colleagues as well from RTD. Now, we are not starting from scratch. A lot of work is already being done in the Commission. starting with the Healthier Together initiative, where we are working already with member states and stakeholders in health promotion and disease prevention of non-communicable diseases. And of course, it's covering and addressing cardiovascular diseases and working, among other things, in impactful actions like screening. So this is indeed ongoing. The EU for Health program is already funding initiatives like Jacarding, the joint action on cardiovascular diseases and diabetes with more than 50 million euros. The joint action on prevent NCD. So we are already using these projects to work on this matter. Now, on digital, also we have ongoing projects that can be very useful, whether it's the 1 million plus genome initiatives. We have a lot of data that is already being gathered at EU level on genomes, which is, of course, extremely interesting in this field. We have a huge project on virtual human twins, which in this field is extremely important, in particular for clinical trials. So we have all the ingredients, and I know that there are ongoing initiatives by the European Society of Cardiology and each like the EuroHeart initiative. So I think that we have really a good ground on this field. We're also working on the EU best practice portal on public health, covering all these. I'm going to leave it there. I hear also the strong call to work on an inclusive way. I think we have already quite a good record to work in an inclusive way in DG Santé, working with all the stakeholders, of course, with the European Parliament and member states as well. And just to close, saying that from an international point of view, this is 2025 is an important year because on the 24th of September, the United Nations General Assembly will adopt a political declaration on non-communicable diseases. So this is also an opportunity. And that's it. For me here today is to listen to you, to get to know you and to continue this journey. And really, I wish you good luck because we need you to help us. So good luck with your work. Thank you.
Thank you so much, Lorena. Perhaps, I mean, Lorena was talking there about, being for work to be inclusive. So perhaps there's an MEP who can, looking at you, who can perhaps. Yes, please go ahead. Yeah. Okay. Yes, of course. Okay, sure. Please go ahead. Yeah.
I'm very happy that we have all this meeting and all these discussions. That my name is Michael Hajimantel. I'm a member of EPP. I used to be a health minister, and during the pandemic for Cyprus, we have heard everything that we need to do. All the stories that not only these people know here, that the whole world needs. The thing that I haven't heard here, and I want to hear about this, is how to solve these problems. It's good to say we should, but I'm expecting from the Commission that they have all these tools and they need that, and they know that we have all these problems for many years. When they come to us again to present us a plan, and this is a plan. This is a plan to go from here to here with targets, not words. All of us, we are judged by targets, and we know we have improved life expectancy, we have improved this, and everyone can be judged by results and targets. And I will be happy to see this next time we are here to have targets, because it's good to be all of us happy and love and having an atmosphere that is friendly, but the people, the European Union citizens outside, they are dying with health problems, and they are expecting us to do actions and targets and results. So please, next time we have a meeting here, it's good to have from the Commission their action plan with targets and specific road show to see how to get to what we all agree and know in this room. Thank you, and sorry if I if my tone was a little bit attacking, but I have a passion on this. Thank you.
No, very well said. I think we all need to show our passion. Please, MEPs, feel free to show your passion. It's a very important issue. Right response. There we go.
Oh, sure.
Yeah.
Well, I can assure you, we have a lot of passion in the Commission as well, and in particular for this subject. And I hope that you will invite the Commission before we come with a plan, I would say, because we are hoping that you are going to support us and help us. And I expect to get input and ideas. So I really sincerely hope we will come with a plan. I think our commissioner has said it. We know the plan has to work on the experience we had on the cancer plan, which I believe was very successful. So we will certainly be concrete, but we are still working on it. And again, I hope that you invite us even before, so that we can indeed work together on this matter. Thank you.
Thank you very much.
Thank you very much. I'm András Kulya from Hungary, from the EPP group, and it's a great honor to be part of this intergroup. And I would like to thank you all who contributed to the establishment of this very essential intergroup. Before I became an MEP, I worked as a surgeon, and it was my part of my everyday job to perform lower extremity amputations, leg amputations. And the reason is very simple: very severe atherosclerosis or microangiopathy caused by diabetes. And as a surgeon, it is really hard to cut off a leg. And not only because you're holding the leg in your hands, but because the statistics show that 50% of those patients who lose their leg die in 5 years. And it is just a very, very small part of the cardiovascular health. And I think we have a very big responsibility on our shoulders, because we have to show our citizens that we care about their health, we care about these issues. And also there is a correlation that when the healthcare system is weak or struggling, the populist parties and the extremism raise. And I think is also a very important part to care about the healthcare, because that's how we can care about our democracy and not letting space to extremism, which destroys our whole society. And one more part, even I really thank you, Professor Price, that you summarized a very important part of this topic. But I would like to highlight that even we have the most advanced AI system and screenings, we have to involve the patients and explain them why it is important to go to the doctor, to visit the doctor, and care about their health. And I think very essential to keep the trust of our patients and citizens. And there is the part that was mentioned by Mr. Haji Pantela, that we also have to show some results, not only talking about this issue and raising awareness, but take real steps. So I think we have a very big responsibility, as I mentioned, but we are very committed to do something for our citizens, because I think they deserve, and we are here because they voted for us, they put trust in us, and we have to thank this trust. So thank you very much.
Okay, there's one last MEP we haven't heard from. Please go ahead.
Okay, thank you, and hello everyone. I'm very happy to be in this group, as being a medical professional, and I'm happy that somebody mentioned, if I remember correctly, Professor mentioned mental health. I was a psychiatrist during my medical career, so I do understand how that also might impact cardiovascular health. So this is very important that you have mentioned that, and I'm happy that we have a good context for this group to move forward. The Commission already expressed willingness to tackle not just the cancer, but also cardiovascular diseases. And very soon in this Parliament, we will discuss Critical Medicines Act and many other regulations like tobacco regulation revision will come into this house. So I think it is very important to be focused on a specific issues. And I think this is an opportunity when those files will come here. We have to have in mind cardiovascular health, the prevention, early interventions, and other practical things that we have to consider. And also one thing I would like to mention, this is not the first group that I'm coming that is interested in the health issues, and I see more or less the same colleagues everywhere. Well, sometimes it's a very natural because most of us, we are somehow connected to health, being a ministers of health previously or medical professionals. So we have to think how to, let's say, concentrate because, you know, it's a very complicated to let's say, address everything in one time. So maybe there's some groups can come together to think how we can join forces because we are very limited in numbers here in the Parliament. So it's good that we started. It's good to hear, I know, the good emotions, the passion, people asking for the targets, for the numbers, for the results. That's very important because that's how we measure if we succeeded, because if we set the target and we go opposite direction, sometimes it happens. I've faced that many times in my own country when we talk about public health, but we do the things that are completely against public health. So when you do the opposite things, you cannot expect that you will get to the right point. So I would really suggest us to join the forces with other intergroups and work together. Thank you very much for this event.
Could I just actually ask you to elaborate when you talk about, you know, collaborating with other groups? I mean, do you want people from non-health backgrounds to join your sort of alliance, or what is you actually searching for there?
It's not just people with not medical, let's say, background, but I have in mind that those who are like in mental health group or brain health or whatever, you know, they are coming the same colleagues together. And it means that we are spreading our time. So we are not focusing sometimes on the things that will come up here to discuss, like the Critical Medicines Act or other important topics that we will discuss. Medical workforce shortages. It will actually affect every field that we have discussion. It would be good if we would have the same, you know, the understanding about how we will solve the problem.
We are just speaking about prevention, promotion, and protection of health. And our idea is to present comprehensive pan-European strategy related to prevention of all NCDs. Because tobacco, please look into Europe is Beating Cancer Plan. You can find all chapter related to prevention. It's the same issues. Nothing new. Tobacco, alcohol, fats, you know, healthy lifestyle, activities, and so on, risk factors, air pollution. Let's join our forces and present comprehensive strategy which should be as umbrella to all 27 member states to act in the same direction, to build synergies fighting all risk factors and of course covering all inequalities together, and proposing to national parliaments to have the same national action plans, harmonized action, because we need harmonized actions around all 27 members. We need to join our forces now. We established interest group, exactly, prevention, risk factors and inequalities, interest group. Goal is to present comprehensive strategy. We can act together with Commission and together with minimum 5-6 committees here in this room. Health in all policies, because we need health for all. But it means in agriculture, in ITRA, in every committee, we can trigger debate that we need to include, because it is cited in the Lisbon Treaty requirement that health should be on the in every committee at level of active action activities. It's for me clear. Let's join our forces. Otherwise, we will follow one group, another group, third force, and we'll finish our mandate without good result. First of all, comprehensive strategy on prevention.
Sorry, just some words to the previous thing, that actually we have a place where we can discuss things together, and it is called the Sant Committee. So yeah, we have debates, and we can go for missions, but I think it's very important to have discussions like this and intergroups also to dig deeper and see deeply the problems of some topics and issues, and bring it together, the stakeholders, the patient representatives, the doctors and the nurses, because I think even we are doctors, we cannot know everything about the healthcare and about some particular topics, and that's how we can learn from each other and make good decisions. So I think it's important to discuss separately these issues, and we can discuss together, and also the Critical Medicine Act in the Sant Committee. There's a place for it. So sorry, it's a bit different opinion, but I think it is very important and part of our job to learn and make good decisions. And to make good decisions, we have to see the different layers and the big picture.
MEP Andriukaitis? I actually wanted to ask you one thing. You mentioned the tobacco. So the tobacco lobby, I think, especially in Brussels, is sort of undefeated. They're like the biggest cancer of all. So within this group, what would be your sort of advice to other colleagues on how to maybe tackle their influence?
We need to ask Commission. Commission has obligations to present to us revisions. And now you see delays. We need to ask now clearly when, and once again when. Because we are only have opportunity now to see how can we then discuss those issues, because delays is not the way to address issues related to tobacco legislation revisions, and a lot of delays.
Maybe I can. I would just add a few words, maybe reflecting to what my colleague said. I'm not against specific groups. I'm just telling that we should not miss the things that sometimes does not come together in the Sant Committee. In the Sant Committee, we have a lot of colleagues that are not medical professionals, and I'm not really sure if already is decided where the Critical Medicines Act will come to, if this will be a health or economic issue. So it is important that we keep health at the top of the priority, because, you know, in every field, it's the same question: what is the priority? And we usually talk about health as a priority, but it doesn't really happen in a real life. Then other things are just dominating. And coming back to your question about the tobacco industry, It's not enough just, to blame the colleagues that sometimes listen to the tobacco industry lobbyists, because what I understood being a politician, I was a very big optimist when I came to national parliament, believing that I'm being a researcher or a medical doctor. I will tell the truth and everybody will believe in me. This is not usually how politics works. So it's our job to talk with our colleagues here in the European Parliament, to explain the things in a simple language, not be too medically specific, because, sometimes it's hard to understand. We call it translation into the politics, how the research and evidence could be translated. It's our job. And it's good that we are coming here together. If we do understand better some things, if we have a lot of knowledge that we can share with the colleagues, we are from different groups. That's our job to do that. We will do the things that we are discussing here. We will bring the news to our colleagues in a different parliamentary groups. So that's how we can prevent somehow the industry's interference, because they will come here. It's a part of our job. We will have the meetings with them. We will listen to them. But at the end of the day, it's the question whom I'm going to believe, whose arguments I believe are more strong. Where is the evidence? Where are the numbers? So we are the ambassadors of the health field, and we have to do our job.
Just a small comment. Yes, it is true. We have different platforms for fruitful discussions, but I am sure 100% that you both think the same thing, that it's time for action, more for action and less for words. The second, regarding the tobacco industry and the influence that it has on the citizens' health, I think it's important to work in two directions. Yes, we are expecting the revision of tobacco directive, and we all hope it will come soon. But we will talk about restrictions when it comes on our table. What we really need to do, I mean, the national governments need to deal with prevention, and the primary prevention. We need to talk about lifestyle of our citizens, and especially of young people. I'm coming from the country where, unfortunately, the lifestyles of young populations are terrible. We smoke too much. Probably the highest rates are in my country. Our young adolescent, they drink too much. They eat junk food. So that's something that we need to deal nationally. And of course, at the EU level, we got a lot of help from the European Beating Cancer Plan. And what we need still is not additional cutting of the budget, because we need money to make all these educational campaigns fit for the purpose. You know what I mean? To be effective. So the Commission will do, I hope, their job, but there is also a lot to do at the national level. Yeah, thank you.
Okay, well, listen, we've spoken, I think lots of the MEPs have spoken, so let's actually get more of a, they've spoken about their hopes, their passions, what they should, can't, will hopefully do, what the European Commission could possibly do. But I think now it's time to hear the patient perspective, and David Kelly, please go ahead.
Thank you. So good morning, everyone, and thank you to MEP Jerkovic and the Each Alliance members for the invitation to speak to you today, and in so doing to offer just some areas of patient perspective on the urgent need for a cardiovascular health plan for Europe and what it should contain. My name is David. I'm 50 years old. I'm a CVD patient since the age of 4, and I'm also operations manager with Global Heart Hub, which is part of the Each Alliance. For the MEPs present today, I would bet that in the majority of your interactions with patients, you mainly hear about the impact on them when health systems go wrong. I'm going to break that mold, hopefully. Today, I'm here with a positive story, a story of how a life can be fulfilled when health systems work as they should, and a little good luck also prevails. That's my experience so far as a patient, and it's one I wish for everybody who is affected by what remains Europe's biggest killer of its citizens. And I firmly believe that with your commitment, better prevention, detection and diagnosis, combined with improved rehabilitation outcomes for those living with or affected by CVD, are now within our grasp. And that luck, either good or bad, should have no part to play and should not be a factor. Before I speak a little bit about my own personal CVD patient journey, I might just take a moment to remind us that behind that term patient, there is a whole life, career, and a network of people and loved ones behind the illness itself. In my case, my wife Trish and my two daughters, Leah and Rebecca, who you can see here in our family photo. That photo was taken 2 years ago, roughly 2 years after my second open heart surgery on the 30th of April, 2021. And the photo to its left was taken 2 weeks after that surgery. Hopefully I don't need to explain which was which, but I said I would just in case. It would also be good to remember that we will all be patients someday. And as such, it's incumbent on national governments to have plans in place that meet our needs at those times, but also preventative plans which help its citizens to live as healthily as possible for as long as possible. We know that when Europe acts, national governments follow. We have seen this in the aforementioned €4 billion investment in the European Cancer Plan. And indeed, a report published by the National Library of Medicine recently indicates that 30 of the European countries surveyed now have a working, funded national cancer plan. But this is against the backdrop where cardiovascular disease, as you have seen today, remains Europe's biggest killer and is largely unplanned for. And we need to change this dynamic. We need to change the narrative that developing CVD is in some way an inevitability of aging or down to poor lifestyle. In my case, as in hundreds of thousands of more annually, we know that that's simply not true. In fact, recent research has put a spotlight on the fact that almost half of the burden of CVD is due to factors outside of the control of the individual, such as inherited or congenital conditions like mine, a predisposition to CVD, or the lived environment or social and commercial determinants. Medical advances are saving the lives of those affected by heart attack and stroke, but the reduced quality of life as a consequence of these events and the effect of comorbid conditions is enormous. I mentioned earlier that I work as part of the team at Global Heart Hub, and my role there, to a large extent, came about due to my own lived experience and my desire to help others who were in the same situation. Global Heart Hub is the first global non-profit organisation established to provide a voice for those living with or affected by cardiovascular disease. We're a global alliance of close to 140 patient organisations, with 65 of those based here in Europe. And our aim is to create a unified voice for those living with or affected by cardiovascular disease. My own journey initially saw me first diagnosed via a simple stethoscope check at the age of 4. And following further tests, I learned that I had a bicuspid aortic valve and severe aortic stenosis. I underwent my first open heart surgery some weeks later in Crumlin Children's Hospital in Dublin in Ireland. And the following 42 years were spent in that period that we call watchful waiting, with biannual checks. And until late 2020, when my cardiologist explained that my condition had worsened to the point that another open heart surgery and a new heart valve was required. I was totally symptom-free at that time. And that's a really important point here. So many of the CVD conditions are silent until the point of an event. No lumps to check for, and often no physical symptoms. And if there are symptoms, we know that too often these are passed off as just a product of aging or as anxiety in the case of women, rather than the real underlying causes. I was initially told that I had a choice of 2 valve types, either a mechanical or a tissue valve. And these are both good options in their own right, but both with their own specific drawbacks, especially in the context of a redo surgery and at the age of 46. So through my own research, I became aware of another surgical option, one which transfers your own pulmonary valve into the aortic position and then replaces the pulmonary valve with a donated human valve. It's called the Ross procedure. This surgery is not widely available in Ireland, and when it is performed, is mainly done in children. But what the Ross has been demonstrated to offer the suitable candidate is all the long-term benefits of a mechanical valve without many of the drawbacks associated with that technology. And in my mind, at least, it was very much worth considering. And so having found a surgeon in Ireland who performs the Ross, over 2 consultations, he listened very carefully to my own preferences, and importantly also took time to walk me through the original two options. My reoperation took place during the second wave of COVID, which has been mentioned here today. And as such, as a family, we said our goodbyes at the hospital door. That was a tough day for the entire family. And I still wonder on the mental impact that those months beforehand, the 8 months in surgery and the 3 months of recovery when I was out of work and looked like that, had on my wife and my 2 daughters. Now, the most important part of my CBD journey was not my own work in advocating for the outcome that I thought was right for me, nor was it the positive shared decision-making I had with my surgeon, but that certainly helped. No, the most important part of my story was that simple stethoscope check at the age of 4. That stethoscope check is zero cost, quick, easy to execute, and it could and should form part of a cardiovascular health check in every country in Europe. But it doesn't. Why? Well, we know why. Because as you've seen today, many EU national governments do not have a properly funded cardiovascular health plan. And now is the time to change this. We have a unique opportunity here to harness the combined knowledge of the 21 diverse stakeholders within the EACH Alliance to help support the development of a CVD plan for Europe and to support your work. I have had the privilege of watching the EACH Alliance develop and come together around this issue. And I know from my own work within Global Heart Hub that it's unique to have a group ready to support your work and to help guide future policy development with a focus on prevention, equitable access and innovation. Now, the policy roadmap which we have today and which EACH has produced uses fancy medical terms in its key points of focus. But from a patient perspective, if I could break these down maybe into what I see them as. Primordial prevention is the first one that's mentioned. Well, that just means stopping health problems before they even start to develop. It's about creating healthy conditions and habits in society so people never get the risk factors that lead to heart disease in the first place. Primary prevention, that's just a way of taking steps now to stop a disease before it happens in people who are currently healthy but might be at risk. Secondary prevention just means catching a health problem early once it has developed and before it causes more serious damage and taking steps to stop it from getting worse. It's like seeing a smoke and using a fire extinguisher before that fire spreads. In my case, it was the simple stethoscope check. And early intervention just means getting the help to someone as a condition is diagnosed rather than waiting until it causes more problems down the road. The earlier we act, we know, the easier it is to make changes, protect health and save money. And best practice rehabilitation means giving the highest quality of care and support to help us recover from CVD problems and improve our overall health going forward. And the last action point, quality of life, just means working together to improve the daily lives and emotional well-being of people living with heart conditions all across Europe. And to do this means creating a standard set of tools that focuses on what really matters to the patient, like how we feel and live day to day. All those 5 points are very sensible approaches, I think we can all agree, and they're very simple when you break them down like that. So to wrap up, if I could firstly as a patient say thank you to you all for the commitment to the Cardiovascular Health Group and the Cardiovascular Health Plan. Secondly, if I could encourage you on behalf of the 60 million EU citizens living with a CVD condition to make use of the knowledge and insights within the EACH Alliance in any way that you need in the coming years and months to advance your work. And thirdly, if I could again thank MEP Jurkovic and the EACH Alliance partners for the opportunity to speak with you all today. And finally, if I could ask you just once more to look at our family picture. The statistics we know say that in Europe, 1 in 3 EU citizens currently die of a CVD-related condition each year. I know that most likely I will, and that's something I live with every day on this journey. But when I'm gone, that still leaves 3 people in the photo. So let's make sure we work together and ensure we push to make that number 1 in 3 redundant in the coming years. Thank you.
David, thank you so much for sharing your story. I think we're all really humbled by it as well, so thank you. I think on that note, we've all obviously been talking about the politics of this group, but to hear your story, to put a face on it, it adds so much more understanding. So thank you so much. I think for myself, we're sort of very near to the end of the time. So thank you all for being here. Obviously, stay around to have important conversations, especially with the MEPs, especially for, all the different people. Sorry, I couldn't get to you. I know Arlene was over there. I wanted to ask you to, say something to everyone here around the table as well. But yeah, thank you all. This is an important group. I hope you all can support it. Let me hand over to MP Jerkovic, our host. The final words. Thank you so much.
Thank you, Miriam. And thank each and every one of you for your presence and for your enthusiasm. It was very motivating to listen to all of you. David, thank you so much for your powerful testimony. It really touched my heart, and not only mine, I'm sure. As Vitani said, we are not a small group, but we are strong group, and our vision is powerful. Our vision is a European cardiovascular plan, a plan with a clear target, with the coordinated actions, and with the funding to back it up. Our vision is ambitious, yes, but I would say it needs to be. It needs to be ambitious because the challenge before us is massive, and we have opportunity to act. And let's today be a turning point. Let this interest group be not only a platform for discussion, but for accountability, for collaboration and results. That is most important, the results. And I invite you all, my dear fellows, MEPs and civil society and health community, to be part of this mission. So bring your ideas, bring your experiences and your determination. Let's go forward together with, as you said, with the passion and determination. Thank you so much for being here today. Thank you. Thank you.